Good evening, everyone, and thank you for returning for one more episode. Last night, we had a great time talking with Michael Jones and introducing the whole topic of fathers and pregnancy. And we will have another conversation tomorrow with two dads who are going to talk about just fathering and being a dad and all that they encountered during pregnancy and after birth. Tonight, we're going to talk about finances and pregnancy, and it's important to take a look at this to understand the health system. This is a part of our series, understanding ourselves and our health risks as we prepare for pregnancy, understanding the health system. And then once we understand ourselves and the health system, then we're able to take more action and be more engaged with informed decision making. So tonight we're going to look at finances. I'm going to pull up my slides again because I need them to stay on point and to make sure I'm not missing anything that I want you to know. It also provides a reference point for you that if you choose to go back and look at the video, a lot of the information is there for you, and you can find that information in the presentations that I have included. So hold for a sec as I take it up. Why do we need to be worried about finances? I'm going to explode this up a little bit more. One is insurance, that we can have the costs for birth, pregnancy and birth covered. But also, what if we have medical emergencies during the pregnancy and we need to have time off of work? Do we have some sort of leave? Do we have any sort of insurance that would cover for that? Do we have money set aside that it doesn't matter if we have a day that we've got the money, it's not going to wreck our family finances? So let's take a quick look at these. When we talk about health insurance, we're going to first look at that, and then we'll move into maternity and paternity leave. Most of the insurance companies, particularly after the Affordable Care Act that was passed by President Obama, now will cover maternity care. And it will cover prenatal visits, inpatient, outpatient, cover labor and delivery, will cover the newborn. It will also cover lactation counseling, which is really, really good and really important. The question is, does that insurance also cover copays? We know a lot of times with insurance, there's a copay that's required. If I go in, I need to pay $10 or $20 or whatever that copay might be. Does the insurance that you have require a copay? If so, that's something that you need to have money for. You'll have to come out of pocket for that. Does it cover anesthesia? Does it cover things such as telehealth? I'm assuming telehealth would be a part of that in an outpatient service. What about classes for childbirth classes, parenting classes, newborn classes? I would really strongly recommend these classes if you've not had a baby before. It provides you with a lot of really good information that is helpful for you. But does your insurance cover that? Some insurance plans will cover weight loss, weight management. So it's all these things to see if your insurance covers those things. If you're choosing or desiring to have a midwife, it's important to see, will the insurance cover midwife? It's important to call them and to see if that is covered. I know that for certified nurse midwives, they have been around the longest. They are licensed in all states in the District of Columbia. Most insurance companies will cover them, and it may list them. They have a directory of what is meant by physician. So you will have to read this information, but you can also call and ask, is a certified nurse midwife covered? Certified midwives are not licensed in all 50 states, and therefore, if they're not licensed, they will not be covered by insurance in those states. So you will need to see, are they licensed and are they covered in your state? When I say covered, also covered by insurance. Same thing for certified professional midwives. They are not in all 50 states, but in actually more states, I think, than certified midwives. You want to check that information as well. We talked about home visits when we spoke with Nicole and when we spoke with Marcia Ford, both are certified nurse midwives. They talked about home visits. And I do believe that most insurance companies will cover home visits, but they don't tell you this. And it's not the normal routine for doctors to recommend home visits. Home visits are seen a lot of times, usually if someone is sick or they need close follow-up at home. But this is oftentimes a part of your insurance package. And it's a good thing. We've talked about postpartum depression as being something that can happen. Yet first we refer to it as the postpartum blues, but those blues can turn into depression. And so it's good to have someone come in to your home after you've had your baby to just check up on you, check up on how you're doing, check up on your family, see how things are going with this brand new baby, and to see how you are doing from a mental health perspective, you and your baby's father. Okay. For public health, for public insurance, usually that is Medicaid or the Affordable Care Act. Depending on where you live will determine what state, which has what. Some of the states have not expanded the Affordable Care Act or let's say expanded Medicaid, that it would be the Affordable Care Act in their state. So both of these are still throughout the United States. So you would need to see what one. Medicaid is dependent upon income. There are other means of assistance if you're needing coverage for health insurance. The other is if you're paying out of pocket, there are things known as sliding fee scales, meaning that you're not charged as much based upon your level of income and family size. So depending on where you're going for services, you may need to check into that. Instead of being charged 100%, you may be charged 25% or 50% of the actual cost based again on your income and family size. They're the federally qualified health centers that have these sliding fee scales. You also want to speak with the finance office at the hospital you're interested in going to just look at what the charges are, making sure the insurance that you have covers, and then see if there's any remaining that you would be responsible for payment. Now let's get into the maternity leave and the maternity and paternity leave. I was really kind of surprised when I read some of the information that I read. You know that maternity leave is not universal in every state. It's not something to know that I'm definitely going to have. It's more available for federal government employees than it is for those that are in the private sector. Let's give you a little bit of history, which I found interesting, and where the ugly head of racism raises itself one more time. After World War II in Europe, there was the need to be able to have babies and replace the population because the war was fought there. And so Europe decided that they were going to do more of a group sort of thing where they would be paying for parental and maternity leave. They would also be paying for early childhood education to be able to build back up their society. However, in the United States, maternity leave was seen as an entitlement. And it was a concern that people would take advantage of this money that be given from the government that businesses and taxpayers had paid into. There was also the concern that providing universal leave would encourage the quote unquote wrong families to reproduce. Now, also keep in mind that during that time was thing known as eugenics, and we'll talk about that in a whole another session. But those things definitely influenced some things that went on in the United States and the desired population that was desired for the United States. Because of that, what we find is that now the data that I could find was from 2020, only about 8% of workers who are making $14 an hour or less have any kind of access to paid parental leave. So a lot of people do not have maternity leave at all. And that really makes a difference when it comes to mortality, for infant mortality, and also with maternal mortality. So let's take a look at what exists. Again, the federal government made paid leave available in 2020, that it would now be available to all federal employees. It's up to 12 weeks of paid leave, and it has to be used within the 12 months following the birth of a baby. It can also be used if a baby is adopted or you are gaining a foster child. Now, the difference now with this Family and Medical Leave Act is for the private sector. And if you are a business that has less than 50 employees, there is absolutely no requirement for you to offer maternity or paternity leave to your employees. If it does exist, it can be used for, again, for birth, if you adopt a child or receive a child for foster care, but it's unpaid leave compared to the federal government, which is paid leave for federal employees. That's important to know, is that even though this leave is allowed, it is unpaid leave, leave without pay. There's only a few states that have decided that they're going to enact paid leave for their employees. And these are the states that have this. Again, this can cover medical leave, caregiving, or parental. One thing that I hadn't thought about, that I read about, is short-term disability insurance. And so those who are working for businesses, private businesses that have less than 50 employees, it's possible that you may be able to collect short-term disability to cover for some sort of maternity or paternity leave. Only about 43% of private workers have access to this. And again, for low wage earners, only about 10% of those earners have access to short-term disability. Only 19% of part-time workers have access to this, and about 57% of those who work full-time have access. So this is something to ask about when you take a job. Are there any benefits available? And ask about short-term disability. Ask about it. So listening to all of this is going to come up with the golden question. Do you have an emergency fund? We have kind of looked at reasons why it's needed. Unplanned leave. There are times when I've cared for women that I have made recommendations to them based upon changes going on during their pregnancy, some danger signs that have come about. I have inform them that they need to be off their feet. They need to be resting on bed rest. The other is that if your job is not going to pay for the leave that you take, it's saying, yes, you can have leave. We would not fire you if you're taking up to 12 weeks of leave, but we are not paying you for that. So this is where you need to have your own money to be able to finance and cover the income that you would be making while you are on leave. And then things come up with your baby that you're not expecting. So you want to be able to have an emergency fund. So some things I may want to suggest to you as we think about all the things that we do during pregnancy to celebrate the pregnancy. We might want to consider the costs related to them. How needed are those things? How necessary are they? There's a lot with gender reveal parties. Sometimes a lot of money is spent on the gender reveal parties. The question would be, is if that's going to be something you plan to do, can that be done at a very low cost? Would be a question. Feel free to ask family and friends if they want to give you gifts, to give you cash gifts. That allows you the option to be able to use that money to cover for any possible leave that you may need to take, that there is no, that you're not being paid for while you're on leave. And then also to save your money, And if we're looking at this prior to pregnancy, just as we talked about preconception visit, getting you ready for pregnancy, think about not only just from a physical standpoint, but what about your financial standpoint? If you have not started an emergency fund, there's some resources that I can recommend to you. Anthony O'Neill is a young Black brother who is a financial expert, and he is an expert in helping individuals and families be able to get out of debt and to save their money and really work towards increasing their wealth. Same thing with Cedric Nash and also with Dave Ramsey. I will put links in the description for you to be able to look at this. So this is the information that I have on finances in pregnancy. I hope that you have found this to be interesting. If you have liked the information that I have shared, I ask that you will like my station, that you will subscribe to my channel, and that you will pass this information on. Pass it on to your mothers, your fathers, your aunties, your uncles, your sisters, your brothers, your cousins, your nieces, your nephews. Thank you so much for your time. And tomorrow, come back. We're going to have a great time with two dads who are going to talk about real life as dads, and also what it was like being during pregnancy and after they had their babies. Also, keep your eye out for my ebook that will be coming soon. I hope that it will be of great information for you. Thank you so much for your time. Have a great evening. Bye-bye.